my time here and my training here. So it's really, really nice to be back. And if you told me when I was here as a resident that I would come back and give a wellness lecture, I would have think that you're completely crazy. I would have just have to call psych. But here I am. Sometimes life is kind of weird. So I'm sure you're wondering why I am giving the wellness lecture. Is it coming up? Is it coming up? So I'm going to tell you a little bit about my stories, like how I got here, how I'm an ER doc and a meditation teacher. So I started meditating when I was in med school. I found meditation to deal with the stress, and I did it really intensely for about 4 years. I went to all the different places in New York that has meditation just to check it all out. At that time, I didn't have a teacher. I was just doing it by myself, but I got really into it. It really helped me with the stress of medical school. But then residency happened. This place happened, which is awesome, actually. But I completely stopped doing meditation. I was also doing yoga before residency, and I completely stopped doing that either. The only thing I kept doing at that time was Muay Thai kickboxing. I was a competitive Thai boxer. I competed throughout residency. Not a good idea. But Silverberg came to some of my fights. That was fun. And I actually came to my orientation. Was that my orientation? My intern orientation with a black eye. People were like, what? They were all wanting to ask me, like, how I got that black eye, Asian girl with the black eye. Should we ask her? So I was like, this is from kickboxing. I just got punched in the face. But in sports, so it's okay. So then I just went through all of residency. I had a great time. I mean, I was stressed out, like you all are probably. But I stayed fairly sane with doing quite a lot of activity, like in Muay Thai. I exercised, I ate well, I slept well, I took care of myself because I was an athlete too. But I was still pretty stressed out. But at that time, I didn't really care about wellness. We didn't really have this day. I mean, we kind of did. We did barbecues and stuff, but we didn't really talk that much about wellness at that time. It wasn't as big of a topic back then. So if at that time, I really didn't care either. If someone came up to me and tried to talk to me about wellness and meditation, I would have rolled my eyes and tried to walk away. But here I am again. So. All I cared about at that time was just really learning clinical stuff and being the clinical monster. And, it worked out. I'm really grateful for my training here, so that was great. But after residency, or at the end of it, I kind of felt a little bit burnt out. Like, I wasn't super excited about starting a new job, so I did a fellowship. And that was great too. I did a sports medicine fellowship, and I was interested in that too. But then I tried to get a full-time job, and I did get a full-time job out in the city. I signed all the papers at an academic place. I was going to be on faculty teaching sports medicine to emergency medicine residents. It was great, but as luck would have it, I had to take a few months off because I had some visa issues. I have a British passport, and that didn't. I needed a few months to get that translated over to the next place. So I took a few months off, and during that time, when I actually stopped and really, did some soul searching, really thought about it, I wasn't really super happy, and I wasn't stoked at all with starting a new job. I mean, I wanted to be, I wanted to go into academics. I wanted to, work for this place, but I just didn't feel quite right. And that was at the time where I found meditation again, and I found my current teacher. And I started, really digging into that and started really doing trainings with him. And so in the end, to cut it short, I ended up not taking that job, burned a few bridges there, but started doing some locums, and I decided that I wanted to do this. I wanted to teach meditation, especially to physicians, because I feel like we really do need it. And I think that this is the right time to do it too, because we have been talking about it for quite a while. And it gives me a chance to just basically bridge those two worlds together. So that's where I am now. So that's why. So I teach public classes. I teach private meditation classes to some physicians, and I'm just trying to grow that. And I'll talk a little bit more about other stuff I'm doing. But so 2 days ago, I had this whole lecture figured out. I actually had this lecture written like about a year ago, because I thought I wanted to do this. I wanted to come in and give this kind of lecture. But then 2 days ago, I decided that there was something missing in it. There's like something missing in it, and that I feel like there's something that everybody who talks about wellness and meditation, especially with physicians, try to avoid, because it's mushy and it's hard to talk about, right? And most people try to avoid it because it's not quantifiable, and people may or may not be open to it, and so they're scared to talk about it. But I decided I needed to talk about it because I think it's super important. So here goes. I completely changed my presentation 2 days ago, so bear with me. So what I want to talk about is basically encapsulated in this picture. Have you guys seen this? Yeah. So this was if you haven't, it's a picture that was circulating on the internet about a year ago, I think. It was taken by an EMT out in Southern California, outside in the ambulance bay of a hospital. And supposedly this is one of us. This is an emergency medicine physician. He just lost a 19-year-old patient, and he's grieving outside right afterwards. I don't know what the backstory was, but I know this. And what we're really talking about today is about our humanity. Again, not something quantifiable, but we really need to talk about it. So in the ED, we have a really amazing vantage point of humanity. It's really raw. You all know. We see births, we see deaths, we see terminal diagnoses, and everything in between. And for whatever reason you went into emergency medicine, this is at the core of it, like it or not. No, not so that we can, lose patients, obviously, but so that we can be right up at the edge and experience the most extreme moments in people's lives. If you have a problem with that, you probably wouldn't be sitting here right now. And we do really awesome clinical stuff. We save lives, with our clinical skills. But one of the things that we don't talk about that is a huge part of our job is to witness this humanity in its most distressing forms in the ED. And it's such a huge part of our job, but nobody ever talks about it really. At least not directly. And that's a problem. And this moment of grief is about losing a really young patient. Obviously, that's, terrible and super distressing. But this moment of grief is also about witnessing the tragedy of life on every shift, every day. And we take that home with us, but we don't talk about it, right? The tragic beauty of life has to include suffering and death. And we take that home with us. But it also actually includes life and beauty too. And if we're not careful about it, we're going to forget about that whole part because of the selectiveness of our environment. We only see the tragedy, pretty much. Sometimes we see something awesome. Sometimes we see something beautiful. But mostly we see tragedy. Mostly we see people in their most distressed times. Even if they come in for something that we don't think is super, is an emergency. It's still super distressing for them. So what do we do with that? Oftentimes we deal with these kind of extremes by pushing away all our feelings. And we're taught to do that, right? We're taught to act professionally all the time. We're taught to, keep our feelings in. we're taught to build a wall so that we don't feel that much. But when you're pushing away the bad stuff, you're actually pushing away the good stuff too. And that's the old paradigm, right? That's what we're taught to do. Like in the Hippocratic Oath, we're taught to put the patients first. So, and then forget about taking care of ourselves. But this doesn't really work, right? You know that already. That's why we're here today. That's why we're talking about wellness. It doesn't really work. Just look at our burnout numbers and the suicide numbers. And I'm not going to put them up on the board because you've all seen that, right? And they're terrible, especially for our specialty. We're so burnt out as a specialty. And why is that? It's because we see this stuff every day and we don't deal with it. Yeah, there are some systems issues at play, high census and all that stuff, but if we're really, really honest, a lot of our burnout has to do with this. Yeah, we might be happier if, our census is lower and we're less stressed out, but we're still going to be dealing with this. So, and you know that, and you've probably come across colleagues or, attendings or whatever who are super disgruntled. They've completely cut themselves off from, humanity, basically. They don't really connect with anyone. They're not able to connect with anyone at all anymore, right? You've all seen those? You've all came across people who are like that. And we've also actually experienced these disgruntled colleagues within ourselves. When we're frustrated, when we're sleep deprived, we are that disgruntled colleague, and at that moment we're completely cut off from everybody. We're not able to connect with human beings on any level anymore. That's the old paradigm. The new paradigm is that with some skill and practice, it might include meditation. There's also compassion training and all of that stuff. With some skills and practice, we stay connected. We're going to be able to savor the connections with people that we come across. And we're going to let our patients feel our caring. And we don't shy away from those difficult conversations because we don't have time. We don't shy away from those, and also we don't shy away from the delightful conversations either. I mean, of course we stay efficient. We're emergency physicians. We stay efficient, but we're not going to let that drive for efficiency shortchange our humanity. And it really doesn't take any longer. I'm not telling you to have a long conversation with every patient you come across. You can show your humanity on your faces, in your language, in your approach when you talk to someone. And you can really show that caring without really spending more time, actually. So that each interaction for us becomes something that's a privilege, that's nourishing for us. And rather than taking a toll, that every time you talk to someone, your energy gets depleted. It shouldn't be like that. And the cool thing is this is actually starting to happen already. That's why we're standing here, and that's why I'm giving this lecture, right? This new paradigm is actually starting. And that's why we have burnout research. And that's why in all the big medical conferences, they talk about wellness. But the heart of it is not just about, sleeping more and why we need to sleep more. Sorry, Silverberg. It is about that too, but it's not just about that. The heart of it is actually about this, about stepping into this new paradigm. Stepping into this new paradigm where we actually celebrate our own humanity. And we're actually leaning into our humanity to become better physicians. So everything we talk about today, meditation, compassion training, all of those are actually practices. And what are we practicing for? I mean, we're not just practicing to be good meditators, we're not just practicing to lower our blood pressure. Yeah, that might be an awesome thing, but it's about this. It's about really connecting. It's about really getting hold of our humanities again. So that's the rant I wanted to give. And And I think the Surgeon General, or our ex-Surgeon General, agreed with this. Unfortunately, he's been ousted. But when I planned for this lecture actually a year ago, he said this in an interview. As I think about the emotional well-being for our country, I am particularly interested in how to cultivate emotional well-being for healthcare providers. If healthcare providers aren't well, it's hard for them to heal the people for whom they're caring. And then he also said that there's a growing body of research that tells us there are things we can do to develop our emotional well-being proactively. And that in turn can have a positive impact on our health. So everyone's talking about this. So how do I define wellness? Like I said, all of those things are important, like eating better, sleeping well, exercising, eating granola or kale, whatever. All of those things are very important. But what's truly important is really a deep belief that we deserve to be well. We're doctors. We know to eat well. We know we need to sleep however many hours. I don't even know. But we know we need to exercise, right? We know that. But why don't we do it sometimes? And why do we self-sabotage sometimes? That's because we don't really have like a deep belief that we deserve it. We deserve to be well. We deserve to be happy. And that's what we can work on in meditation and in all of those practices. And one of the other reasons why we might put off our wellness is this waiting game. There's a myth in our society and in our educational system that happiness is a reward for performance, right? Like it's kind of an if-then statement. Like if I get through the next thing, then I can be happy. So if I get through med school or residency or fellowship, or if I get that next attending job that has less clinical hours, if I can buy down my clinical hours, then I can be happy. And then I can start taking care of myself. But that doesn't really work because happiness has to start now. Because if you wait, then there's always the next thing to chase. You might start having a family, things happen. And then we end up in a never-ending kind of cycle of waiting. And also, there's a lot of research that's been done that happiness actually fuels performance. So sacrificing happiness for success doesn't really work out that well. The other thing is that we think we're tough. I think maybe it's gotten a little bit better now, especially in emergency medicine. I mean, we've always been like the tough guys. But now it's a little bit better. But we think we can just tough it out and wait it out. And like I said, it's kind of the misunderstanding of the Hippocratic Oath that we have to put the patients first, put our work first, and forget about ourselves. But if we ignore our own wellness, it actually is a disservice to ourselves. There are a lot of research that's been done that there are a lot of things, if you ignore your wellness, you can increase error. We'll talk about that later. There's also decreased empathy, and we'll talk about that also. But then also people retire early when they burn out. And how are you going to serve the patients if you retire early? Some of us also adopt harmful coping mechanisms, and none of that really, all of that is just unfortunate because we can deal with this better. So how does meditation fit into all of this? This, some ancient practice of some, weird hippies in the Himalayas. How does that help us? So meditation is an ancient practice that lets us take responsibility of our own internal states. And with meditation, we can practice to get more in touch with ourselves, and then you can discover the blockages, like what's blocking us from really believing in believing in that we deserve wellness. What's blocking us? Why are we acting like that? We also get better at focusing our attention rather than being scattered with a million different thoughts. We can learn how to calm our minds so that we can be more focused and be more present moment to moment. And also, the practice, I think Scott Weingart talked about this a little bit in his lecture on meditation. He talked about how meditation can give you a little space, a little pause between a stimuli and an action, so that you're not reacting from a conditioned response. So you're not just flying off the handle or coming back with some kind of snide comment, or it's not that you don't get angry, you just get a little more space to be able to choose. So as I mentioned, Scott Weingart gave a lecture on meditation. I don't know, has anybody watched it? Okay, Silverberg has watched it. One person did not. There's a link on it of it on the EM Crit site. He talked about two kinds of meditation: attention focusing meditation and contemplative meditation. And we're going to actually do both of those today, just a version of both of those today. There are actually many, many different kinds of meditation. And if you're interested in that, I'm not going to go into all of them. But if you're interested in that, you can reach out to me and I can talk to you about that. There are actually many different kinds of meditation out there. And the ones that are mostly talked about is mindfulness. And that's actually just one very, very specific practice that's based off of a Buddhist meditation, just one kind. And it's a very simple meditation, so it's a little bit easier to research and all of that. So that's why most of the research is done on that. But if you're interested in the neuroscience of meditation, there's a ton of research now. Like I said, most of it is done on mindfulness. Doesn't mean that other meditations are not good. It's just that it's just selective. It's just the people who do the research are all interested in mindfulness. It's just it's very easy to practice, it's very easy to research. So if you're interested in that, I actually have a huge long list of references of a lot of the research that's done on meditation, and I can send that out if you guys are interested. But when I was looking through this is one of them. This is kind of interesting, I thought, so I'm just going to put this in there. This is actually done a research study done by positive psychologists. That's a branch of psychology that studies happiness and positive affect instead of pathology. And I just thought it's kind of funny, so I put it in there. But it's actually relevant. So what they did is that they were testing the accuracy and the speed of doctors diagnosing patients. They were given a narrative and they were supposed to come up with a diagnosis. And they gave some of these docs, they primed them with a gift of candy. They're not allowed to eat it, so we're not talking about any kind of sugar, whatever. It's just they primed them with candy. They're like, here, this is a gift. And the people who got the gift actually exhibited more creativity and were nearly twice as fast. And that's kind of awesome because this is kind of what we do. Because the lack of creativity is what causes anchoring. If you remember, anchoring is the inability to let go of the initial diagnosis, even in the face of new information that contradicts the initial theory, right? So they're holding onto that initial feeling and not able to move on. But for some reason, positive affect actually helps with that kind of error. So I thought that was relevant for us because in the ER, we really only get negative feedback, mostly. We don't really get much encouragement. We don't really get patients giving us gifts. Whoever got a gift in the ER? You did? What did you get?
I'm gonna sketch you for the family member brought me some taquitos that they had made.
Taquitos. Awesome. Yeah, I mean, I never got a gift. But, so that's the thing, we are bombarded with negative interactions. And so we need to learn to give ourselves that candy, basically give ourselves those gifts by encouraging ourselves. And knowing this, maybe we can give other people, each other encouragements too. and really help with this positive affect. So I thought that was interesting. But I wanted to lead you in a meditation. So we're going to do a breath meditation. How many of you have meditated before? Can I get some examples of what kind of meditation you guys have done? Huh? Headspace. Anyone else? Vipassana. Did you do the 10-day? Cool, awesome. Anyone else? So this is a guided breath meditation just to get you guys to experience it. So why don't you guys stand up? Actually, we're going to stretch. Hey, what's up? So we can just reach our hands up. I also teach yoga, so this is kind of from yoga. And then get on your tippy toes and just kind of stretch out your calves too. And then come back down. You can grab your left wrist with your right hand and then turn over to the side.
Which side can?
Well, I'm mirroring you, so. And then go the other way. We're going to stretch out our necks just very gently. Pulling your head down a little bit, just very gently. And then stretching it to the side, whichever side, gently. It's more about lengthening rather than pushing it down. And then the other side. And then just a few head movements in one direction and then the other direction. And then clasp your hands behind your back and just open up your chest, look up, and breathe. See if you can drop your shoulders. Few breaths, thinking about bringing your breathing into your chest and opening your chest. You can release that, shake it out, and then open your arms to the side. You can hit the person next to you, it's okay. And then just give yourself a big hug to stretch your upper back. And then open it up again, the other way. And then just shake it out again. So this last one I really like. It's really good for people who punch a lot. So I don't know if you guys punch a lot, but you can put your hands back to back and then one over the other. And then interlace your fingers. And then drop your shoulders. And then swing your hands from side to side. You can feel a stretch in your forearms. Just slowly. It might be a little crunchy, but especially if you punch people a lot. Huh? Oh yeah, it's good for people who use the computer a lot. Yeah. So and then now just shake it out again. Hands back to back, and then flip it the other way. And then do it again. This should feel really good, especially for those who use the computer a lot or do other things with their forearms a lot.
Like rock climbing?
Huh?
Like rock climbing?
I don't know what you guys do. Just shake it out, and then take a seat. Okay. So before we settle in, we can do a little twist in our seat also. So just grab the outside of your, outside of your knee, either side, and twist to one side, and look over your shoulder. And breathe. And then go the other way. Okay, come back to the middle. All right, guys, let's settle in for meditation. So let's chill it down for a sec. So to set up for meditation, you don't have to sit on the ground cross-legged. I do because I feel comfortable doing that. But if you feel comfortable sitting on a chair, that's totally fine too. What I do is what you want to do is you want to put both feet on the ground. You don't want to cross your feet or your legs. And then you can put your hands on your lap. You don't want to be like holding your hand or doing something weird or fidgety. You can either lean on your chair, lean on the back of your chair, or you can come forward. I tend to not use the back of my chair because I tend to fall asleep really easily. And I'm guessing some of you do too, probably are really good at falling asleep anywhere. So I would suggest you can just sit forward a little bit and not lean on the back of your chair. Can you guys hear me back there? Okay. So when you're ready, just close your eyes. And for the first few breaths, just get used to having your eyes closed. And just acknowledge that it might be a little bit weird. You're in a room that you're not usually in. You're with your colleagues. It's a little weird to have your eyes closed, and that's fine. Just acknowledge that. And then bring your attention fully into the room by first listening to the sounds in the room. You can hear the fan going. You can maybe hear the person next to you breathing. Then bring your attention into your body by first noticing the air on your skin and the clothes on your body. And then bringing yourself into your body by noticing your breath and how that changes your body as you breathe in and out. We're going to start by relaxing from head to toe. So first, bring your attention all the way up to the top of your head. Relax the top of your head and your forehead. Really let that area between your eyebrows go. We hold so much tension there. Relax your eyes, the area around your eyes. Relax your face, particularly your jaws. You can take a moment here to open and close your mouth or move your jaw from side to side to release it. Relax your tongue and your lips. Relax the back of your head into your neck. And then let your shoulders relax too. Let them fall away from your ears. Relax your arms all the way to your fingertips. Now relax your chest. You can take a few breaths here to breathe into your chest and just feeling everything in your chest and your upper back relax. Now relax your belly and your lower back. You can take a few breaths into your belly too. Obviously, we're not actually taking our breath into the belly, but you know what I mean. Relax your hips. And really feeling your seat on the chair, feeling that tactile sensation. Now relax your legs all the way down into your toes. And then feeling your feet on the ground. Now bring your attention to your breath just by noticing it. Don't do anything with it yet. Just noticing what your breath is like. And the sensations of the air coming in through your nostril and into your lungs. And in meditation, especially if you haven't done this before, it's very easy to go back into thinking. And that's completely okay. You just catch yourself, you follow my voice. When you catch yourself thinking about other things, just gently bring yourself back to my instructions. Now, you can make your breath really smooth. Not with too much effort. You're not trying to make your breath really long, but just put a little bit of attention there and see if you can make your breath really smooth. Like it's the same all the way through your in-breath and your out-breath. With a little bit of control, but not too much. You're not trying too hard. Just noting if your breath is smooth. And if it's not, just smooth it out. Now for the next few breaths, make your breath a little bit longer. Not so long that you're using too much effort, but just make your breath, both the in and an out, just a little bit longer than before. And just as smooth. Again, when your mind wanders, just bring yourself right back. It's completely natural. It's actually been said that the act of meditation is actually the act of bringing yourself back. So there's no shame in wandering off. It's just about bringing yourself back. Keeping that breath a little bit longer than usual, really smooth. Now, I want you to bring a little bit more enjoyment to it. This is a little bit of a weird meditation instruction if you've done it before, but it's a way of engaging our emotions too. See if you can really enjoy the breath. Like each breath is a new breath. Like you're just walking out into a fresh meadows and just taking a breath into the fresh air. You have to use your imagination a little bit. You can use a little bit of imagery, like you're walking out into a beautiful meadow with fresh air and trees. You're really enjoying each breath, letting yourself go into that, really enjoying it. Like, wow, this is the first breath, stepping out from inside, going out into a beautiful meadow with fresh air, plants. The air is fresh and smells a little sweet. enjoying it, like it's your first breath. You're coming out from somewhere warm and stuffy into this fresh, open space. Again, every time you wander, you can just bring yourself back to those instructions. Engaging with the enjoyment, engaging with the attention. Now, in your next breath, you're keeping that enjoyment and that attention to the breath, but you're bringing your attention to the little pause between the in and the out, right when it changes. After an in-breath, you can feel that as it changes back into the out-breath, there's a little bit of a pause. That's natural. Bring your attention there. Right when you switch between an in and an out, there's a natural pause. Just see if you can bring your attention there. This is not somewhere we normally put our attention. And see if you can feel that space in between the inspiration and the expiration. There's a little space there that's natural. Now see if you can enjoy that space by making it slightly longer, by very gently holding your breath after an in-breath. Not with too much effort at all. You're just very gently holding it, like you're holding a little bird in your hand. You're not trying to squeeze it. Just for half a second. And when you're holding, during that half a second, see if you can enjoy that space. A lot of times, a lot of people tell me, and I feel this in myself too, when I do that, I feel a little space in my thoughts, a little space kind of in my brain. Like it's hard to explain until you try to experience it. But after the in-breath, just gently hold, and then during that space, you can feel a little bit like you're floating. And then just let your breath come back out. That space, it's kind of like, if you remember when you were little, you're on a swing, you swing up, and then you're kind of floating for half a second, or a split second, up there, and then you're floating back down. That's what that space feels like to me. When you're up there, you're kind of floating just for a split second, but it's so enjoyable, like you're hanging there in the air. See if you can feel that, like really enjoying it. Like imagine you're on the swing set, your in-breath is like swinging up, and then you're floating up there, and enjoying that split second of freedom. And then you're swinging back down in your expiration. Just a few more breaths like this, so just know that it's going to end soon, but you're going to really enjoy it. Letting that kind of feeling of freedom, of floating, in that little bit of holding of your breath. Let yourself fully enjoy it, like you're floating out in space for just a split second. And then you can bring yourself back to a regular breath. Let go of all your effort. And then just feel into yourself and see how you feel. It's important to know, to get sensitive to how you are after a meditation. What is your body like? Or how are your thoughts and your emotions? Has anything changed? Just taking a note of that. And then when you're ready, you can gently open your eyes. And then just start moving your body gently just to get out of it. Any questions or comments about that? How did that feel? Anybody?
I personally enjoy it.
Thank you.
It's much needed.
Uh-huh.
Even if drifting at times, so it's coming back to the center.
Yes. Cool. Awesome. Yeah, so, I mean, this is just a very, it's a simple and a little bit different from, say, someone who's done mindfulness. It's just a breath meditation that gives you a little bit of more instruction and a little bit more tactile and like that enjoyment, that instruction just kind of helps get you a little bit more engaged. A lot of us, when we first start meditating, gets frustrated because we're just like, the instruction is just feel your breath. And then you're like, okay, what am I supposed to do again? And then you kind of drift off and it gets frustrating. So I think this kind of meditation is really helpful for beginners because it really helps you get engaged with it and it's relaxing. So any other thoughts? If not, then we're gonna continue. Okay, yeah. Uh-huh. Keep yourself what? Yeah. In meditation, you mean? And that's actually a lot of times okay because we really do need to sleep. And but also if you really want to practice, there are some ways to do it. Like I said, I don't lean back. Were you leaning back? Yeah. Yeah. Sometimes that helps. Sometimes like having, some people use music. I don't use music, but some people do. That can help stimulate you a little bit too. But sometimes it's okay to fall asleep, because we need to sleep. And I wouldn't feel bad about falling asleep. If you need to sleep, you need to sleep. So I would just, what I do is if I have a time crunch, I would set a timer. Because if you're afraid of falling asleep and then like missing something after, it makes it kind of hard to concentrate and makes it kind of hard to relax. Because you're like, oh shit, what if I fall asleep and miss my next thing? So I would set a timer. If I would set the timer at when you have to leave. So then at least you have some kind of safety. That's just my...
That whole progressive without taking from top to bottom.
Yeah.
A lot of people describe that as a good way to fall asleep. People are
True.
very wound up.
Yeah.
Especially when you come home for a shift and you're thinking about all the pages you saw, and then all the time going from top to bottom. It's just a way to get yourself to relax and stop thinking about your shift, stop thinking about what is going on. It's a great way to go to sleep.
Cool. Yeah, it's called a body scan. So if you want to have like a guided body scan, you can just look that up. It's called a body scan. What were you gonna say? Yeah. So mindfulness, they do that too, but in my tradition, we also use that to just kind of relax and get you out of whatever you're doing. So that can make you fall asleep, which is not a bad thing, you know. So just be, if you're on your couch, just be somewhere. But if you really want to practice, then set yourself up so that you have some kind of stimulation, or don't be like, laying on the couch. And, I'll just fall asleep in 2 seconds. So, yeah. But sometimes you just need to sleep. So, it's okay. Yeah.
For people that are starting to meditate, how long is the try for?
Not long. I would start with 5 minutes. This is the best advice I have that I heard from my teacher. Stop before it gets annoying. Stop before it gets not enjoyable. Because if you want to, if you're cultivating any kind of habit, you want it to be enjoyable, right? You want to come back in the next time really wanting to do it. You don't want to be like, I don't know, it sucked last time, so I don't know if I want to do it. You don't want to do that to yourself. You want to engage it. You want to engage with it in an enjoyable way, and so that you can come back to it the next time still enjoying it. So I would stop if you're sitting there and at 4 minutes you can't stop thinking about other things. You just can't. So that's fine. You just get up, right? You just get up and be like, I'm done with my, just be nice to yourself. It's okay. I'm done with it today, and I'll come back to it next time. So, yeah. So the next thing I want to talk about is compassion. And if someone said this word to me when I was a resident, I would have probably just rolled my eyes. Is Jessica's dad still work here?
Yeah.
Okay, cool. She, whenever I think of compassionate doctor, I think of her. And too bad she's not here today. But I really didn't really appreciate it when I was a resident. And I'm going to tell this little story. I remember working with her one time in the CCT, and she was being so nice to some family member. And she was going way out of her way to get them chairs and was super nice to them. And I just remember in that moment as a resident, I just internally rolled my eyes and was like, who cares? I mean, as long as we can take care of the patient, clinically, I don't really care. It's not like I'm not a nice person. I mean, I'm not a bad person, but I just didn't think it was that important. But now I think differently, and I'm standing out here with the slide that says compassion. So here goes. So I've definitely changed my mind. So we confuse compassion and empathy a lot. We use them interchangeably. We talk about compassion fatigue and empathy fatigue like they're the same things. But recently in social neuroscience, they actually discovered 2 different brain states that are completely distinct. So this lady, Tanya Singer, she's the director of social science at the Max Planck Institute, and she did a bunch of studies with the fMRI scanner on these 2 states. So she scanned, I don't know if you guys have heard, if you've done Vipassana, you probably have heard Matthieu Ricard. He's a very famous Buddhist monk, but he used to be a PhD in cellular genetics. And this is what he looks like. He's called the happiest man alive. You can look that up, because they did a bunch of studies on him. And so what they did was they put him in the scanner and told him to get to a state of empathy. And as Buddhists understand it, empathy is a state where you're really putting yourself in someone's shoes, really feeling their suffering, really feeling where they're at, and just really putting yourself there. And so he went in the scanner. He remembered that he watched a documentary on refugee children earlier that day. So when he was laying in the scanner, he was just thinking about these refugee children and just really feeling their anguish and their suffering. And so they scanned his brain. He came out of the scanner completely exhausted from like thinking about these children and just really feeling them. And they're like, "Oh, are you okay? You want to, continue?" And he was like, "Sure, I'll continue, but let me do compassion this time." So the Buddhists have a very specific compassion meditation where they first feel empathy. So they first feel that's like really put yourself in someone's shoe. But then there's a next step. Compassion is when they really start wishing that person well and putting everything in their being by saying, I'm going to do whatever I can to help you. Not necessarily like going over to Syria and helping those refugee children, but like really putting your wishes in there to wish them well. So the way it goes is they, in that meditation, they would bring someone up in their mind, like the Syrian refugee children. Then they would say to them in their heads, like, may they be well, may they be happy. You might have heard of this kind of meditation before. It's called a metta meditation. And then they go through and just feel this. And they found that this kind of state is completely different. They scanned his brain again when he was doing this, and it's a completely different pattern. And so they realized that there are two different states, that empathy is completely different from compassion. So what we're really talking about when we say empathy fatigue or compassion fatigue is actually empathy fatigue. That's what they say. It's a fatigable state. But with compassion, it's actually not fatigable. Like it's because you're actually putting your wishes in there. It becomes a positive affect. Instead of a negative affect, it becomes positive. So empathy fatigue is actually can be caused by secondary traumatic stress. It's from witnessing trauma, like we do every day. When we listen to terrible experiences, when we listen to terrible stories, we take that in, and that can cause secondary traumatic stress. And they've already demonstrated this in research, in oncologists especially, and social workers. And it's actually, an accumulation of those emotional residues that comes with working with people who are suffering or traumatized, which is us. But then compassion itself, even though you start by feeling the suffering of the other, because of this change into a positive affect, it becomes a trainable state that actually overcomes empathy. Does that make sense? So there are some benefits of compassion that we've seen in research. There's benefits in giving compassion. There are benefits in receiving, of course. There's even benefits in observing compassion. And there's a meta-analysis that shows that receiving compassion or actually giving compassion can reduce inflammation and all of that stuff. And the other interesting one, there's the next study is that they found that volunteers actually lived longer than their non-volunteering peers if the reason for their volunteering is altruistic. So and then they talk about compassion in the study. It's interesting. And then they did a bunch of hospital studies where they studied patients and people who receive compassion, who have nice doctors, basically. They have a reduced post-surgical pain, reduced surgical recovery time, and improved trauma outcomes, which is important for us. And then a bunch of other stuff too. The other reason why compassion is important is what I call microburns. Sometimes, like for me at least, when I work, the thing